Good afternoon, we bid to all. Thank you, Associate Professor Dr. Raja Azman Raja Awang, our speaker of the day, fellow USM and UPM students, and to everyone present today for taking your precious time to be with us this afternoon. My name is Victor, and I will be your moderator for today. Before we begin, I would like to confirm if everyone can hear me loud and well. Thank you for responding. Once again, a short reminder to everyone, please kindly mute your mic throughout the webinar for us to have a seamless webinar experience. Thank you. Without further ado, we shall begin our webinar today with our national anthem, Negaraku. Ladies and gentlemen, please rise for the national anthem. Please be seated. Now, let me introduce our speaker of the day, Dr. Raja Azman Raja Awang, who will be sharing on periodontal diseases with us today. Here is a brief introduction about Dr. Raja. Since 1999, Dr. Raja is a periodontist and lecturer at the School of Dental Sciences of University Science Malaysia. Dr. Raja received his PhD in periodontal immunology from the University of Glasgow in 2014. He completed his specialist training in periodontics in 2004 and his first degree in dentistry in 1997 at University Malaya. In addition to treating patients and teaching dentistry, Dr. Raja's research interests include periodontal clinical studies and immunology, as well as dental biomaterials. He teaches periodontology to dentistry students at undergraduate and graduate levels. He has published a number of internationally refereed research articles on periodontology and dental biomaterials. He is currently the head of Periodontics Unit at the School of Dental Sciences at USM. He served as the president of Malaysian section of the International Association for Dental Research, IADIA, from 2018 to 2020, as well as vice president of the Malaysian Society of Oral Microbiologists and Oral Pathologists from 2018 to 2020. He also writes children's educational books for Dewan Bahasa and Pustaka. Without further delay, ladies and gentlemen, please join me in welcoming our speaker, Dr. Raja. Doctor, the stage is yours.
Thank you, Victor. Can you check if my voice is heard? Okay, can you hear me, Victor?
Yes, doctor.
Yeah,
I can
I'll
hear your
share
voice
my
loud and
slide.
clear.
Yeah, I'll share my slide and then. All right. Is it shared now? Wait, yeah. Sorry, it takes some time. Okay.
Okay, doctor, now we can see your screen already.
Okay, great. Right. I'll start. Okay. Thank you for the invitation, Victor and all the team. I would like to start with congratulate you all for organizing this session meeting, right? This is for me, it's very beneficial to you to learn how to work together in the future. I look at this as a very big event actually. I saw about 200 people are joining this webinar today. This is a great effort actually from the medical team, and then try to link with the dentistry, which is at the specialist level sometimes, to let you know that they are not communicating. This is a good news that you at the level of student and then try to make it a link or kind of cooperation between the two groups, which normally they are not working together. Probably some of them in the small group, right? So it's a very good effort, and hope you can do this throughout your career. As for today, the topic is honestly is very big, and then I heard from Jess that the audience is a mix of medical student and then some other student as well, which is it's very difficult to attain all. So what I try to do today is try to give a kind of simple and enjoyment presentation. At the same time, I try to include the academic point of it also. Try to give more serious and more knowledge in this area as well. But try to be simple on this afternoon of the weekend. I decide to start with my introduction of me. So hopefully by doing that, you know me better, and then probably what I've been throughout my career or my life can be a beneficial or something that you can compare with you, and you can be better from that. I'm already 50, so I think I'm in the position, okay position to give advice. Yeah. So I'll start with my how I start my career in uh, you see, I studied dentistry in UM in 1997. I graduated, and then during that study time, I found it. I faced many difficulties. Like I noticed that some of you are having right now, right? Some of you are having difficulty in study and then feeling like quitting or something like that. But that is normal. And then as for me and my friend before, we've been through that part of the life, and then we also have that time when we thought of quitting. Me myself, I also have that period of time where I feel it's terrible. I cannot go through that study life as medical dental student, and then I feel like quitting. But eventually, when I complete my dentistry, and then I even swear to myself saying that I'm not going to go back to that University Malaya again because of terrible life I'm facing during that time. But eventually, when you graduated, after a few years, I registered into UM and study again. That this is a thing that I'm trying to tell you that the things that you find during your time is probably, I mean, uh, you don't try to take it seriously. I try to take it this way, like when you playing game, right? When you playing at the first level or second level, your hero experience at that time is very small, right? You have 5 HP or something like that, and you fighting the enemies in that level. So you found it's very difficult to fight, but that's actually is the enemy that only suit to your side, to your time at that moment. Same thing with our life as a dental student, medical student. The problem that we face is actually enough for us at that level to control. What I'm trying to tell you here is that for example, when I reach the level I'm doing PhD, I'm still having the other problem, but the problem now become difficult. But imagine if me at the PhD level, I have the same problem that I have at the graduate level, undergraduate level, probably that problem I can handle easily. You see, so when you have problem at this time at the undergraduate level, usually when you can overcome that problem, in the future, when you look back, you actually can laugh at that problem. Actually, it's actually very small the problem you can handle easily, but because your level at that time are not experienced enough to face the problem, you find it's very difficult. It's okay to feel bad or feel sad, but try to overcome that problem and try to face it. Right? It's not. It's not. It's nothing that a problem that cannot be solved. Right? So in my life also, some of you have your own life. I mean your own talent, your own interest. As for me, I like to do this kind of recreational activities. So when you do your study in your undergraduate time, try not to forget your talent. Try not to forget your interest in your other skill. You are proposing or continuing your career in this undergraduate time at this time, but don't ever forget your talent, that you need to nurture that talent as well. During these 4 years of study, you don't want to waste your time focusing only on academic. Try to give some time on your talent that you're good at. For example, some of you good in writing or editing video, or some of you good at dancing, singing. Do that at the same time, because the moment you face problem during your study time, those are the things that can help you overcome your problem actually. And eventually, when you keep continuing nurturing your talent during your study, you will become better and better in your talent. And eventually, when you graduate and you start working, you don't know, you will find out that your talent will be useful during your working time. So I do this lot of activities, like this one is Everest Base Camp and Annapurna Base Camp, and also in our, from, if some of you from Sarawak, you must know this place Murut, right? And Tahan. And I also enjoy my small kayak fishing thing, and I do a lot of things. And then I start sharing my activity as well. Apart from I have my small YouTube channel. This is all my friends. I force them to subscribe. It's not a good small thing. The reason I show you here is that I want you to start sharing the things that you feel you're doing good, and you try to share with people, and then probably some people get benefit from you. This is just one example. Probably you are good in writing or in reading, in drawing, you can share that part of thing. So this kind of activity actually can contribute to your mental strength actually. I mean, give you more benefit to you. I mean, or your life is more fully, I mean, you're taking advantage of your life fully, right? I mean, you need to do this, okay? So as part of that, like Victor mentioned in the introduction that I wrote to the Dewan Bahasa and Pustaka, this is part of my sharing also. One of the first book that I wrote is about the phone meow. It's actually, this phone is used to communicate with cats, something like that. It's a futuristic book. Then I also, since I'm a specialist in dentistry, I also wrote book about the education on Kacik Geraham Dataring. It's actually the education for new generation about how to take care of the caries or oral health. Kan, I'm working on the third book just now. So you and the new generation, you are more talented and more, I mean, multi what do you call it? Multitasking kind of people. So you can try to starting with this kind of activity. But by the time you graduate, you start to accumulate more experience, and you can start on your own. This is among the things that are in that books, to education books, right? So I mean, try to be people who can change, right? Try to be the first or people to change things for the benefit. For example, what I'm trying to do today, if you remember during our small time, you probably have this song or this pantun, right? Burung kakak tua hinggap di jendela, nenek sudah tua, giginya tinggal dua, kan? This is not good pantun for our generation. I mean, we're telling people that when we get old, we only have 2 teeth remain. So when we grow up, we have this kind of brainwash by our pantun telling us that it's okay to lose teeth, right? When you get old, you can only afford 2 teeth. This is the thing you need to change when things are develop and we become better, many community now become better. We should have in internationally now people are moving on having more teeth. I mean teeth for for permanent teeth, for old age, something like that. So basically, we try to change this, and then, all right, wait, yeah. we try to change and move people by changing the pantong. Like, this is the one that I asked my daughter to say.
Burung kakak tua hinggap di beranda. Nenek sudah tua. Giginya semua ada.
So basically, we want to change for people. Probably this is not going to be effective for the time being, but this is an example that I want to show you things that we need to change our society, our community. We are on a bigger dental or whatever field that we are in. We try to get involved in the society and then take part in the society. And if possible, if we can have a chance, try to change our society to the betterness. No, I want to change the slide. Okay. All right. Enough with the introduction. I hope I gave you some good introduction for your benefit or something. So now we are start to the dentistry, right? The dentistry. So as I started initially, it's very difficult to me because the audience are different kind of the group interest. Some want the academic kind of information. Some just want the information for interest of knowledge. And then some just want to have some interesting chatting at the end in the session. So I try to mix all, then try to make it as simple as possible for this afternoon, right? It's not, see, most of us, right? We don't usually look into our teeth, right? We don't usually look into our teeth that make it different to the other parts of our body. For example, for the skin, for the eyes, for the ears, we always checking on that part of the component. So whenever problem happen on that side, we try to get it solved or try to treat the problem or make it right again. But for the teeth or inside the mouth, usually people are not aware of it because the mouths are always in the hidden condition, and then we are most of the time are not looking and checking on our mouth. Then even I don't know if we are most of us realize or not, but they are always saying that the mouth is actually gateway to the rest of our body. It's fair enough for the food that we take is actually contribute to general health of our body, right? That's a very interesting, straightforward facts. But the other part also, we also know that something that we found in the mouth actually can give an initial indication that something is happening in our body. For example, if we found some very inflamed gum, and which is when we treat and it's not healed properly, usually we can guess it can be related to the diabetic condition or other systemic condition, which is kind of from the mouth, we can actually guess what is happening in our body, the rest of our body. Okay, this is an interesting fact. You know about the global burden of disease, right? GBD. The global burden of disease mean the disease that becoming a burden to our economy or population. Then the periodontal disease is number 11. And then interesting is number 1 is still the oral disease, which is caries. But because this disease is not actually causing a kind of serious problem to the health, something like it's just been there, but it's not going to be a serious problem. People are not really concerned of the caries and also periodontal disease. So this is a thing that we need to know, that they are actually among the top cause of the or what we call a global burden of disease in the world. It's from 328 diseases evaluated throughout the world. They are almost the top 10. And so why it's so important to understand about periodontal disease, right? Throughout the world, is 60 to 90% are affected by periodontal disease. this one when we are talking about the simple kind of periodontal disease. But when we evaluate or look at the severe part of the disease, it usually goes between 15 to 20%. It's actually quite high. If you have 100 people in a population, 20% are having 20 out of 100 is considered high, right? And then the number in Malaysia also not much different from the world population statistic. So it's very high. So we need to it's important to take care of the periodontal disease. Right. In the simple way, how I want to describe periodontal disease is that when we look at our nail and the finger, right? And we look at our nail and finger, we look at the tissue or soft tissue and then the hard tissue are side by side. Same thing, they are not exactly similar, but close resemble. Then we have gum and then we have the teeth or the tooth, right? They are closing together and then they are not connecting actually, but they are adhere side by side. So what are the similarity between them? Yeah, that you familiar with this condition, right? Ingrown nail. In our local Malay, we call it apa? Sembayan, kan? So this is very smelly, and then it is caused by the ingrown of the nail into the tissue. Then what happens next is that after the ingrown, the bacteria start to accumulate here. And then infections start to occur and then causing a very painful condition. Then if you get, probably some of you already experienced this, and you start picking up, and then some of you try to smell it, right? It's a very, very foul smelling. Right. So this is the inflammation process occur here in acute condition. It is happen in acute way. See what the difference between the periodontal disease. So what happened at the area here now become so much different. Yeah. You see, this is the redness is called the inflammation condition. The similar thing in this case because of the injury by ingrown, but because of the bacteria accumulate here so much and so long, and then it become causing the tissue on the side to become inflamed, right? This is how the periodontal disease occur. Similarity with the ingrown nail, but it's all about the bacteria attacking the soft tissue. But there are different conditions, but that I'm going to tell you a little bit more later. So basically, this is a healthy condition, a very good, nice, shiny, healthy teeth. Then because of then it become first degree of periodontal disease, which is called gingivitis. You probably heard of it before. Actually, inflammation of the margin of the gum only. It's not involved the bone yet. So somehow after so many years, actually we don't know what is happening here. Even until now, we don't know what is happening here. After so many years, suddenly the disease changed into this condition, which is called periodontitis, right? If you can see now, the difference is that this one is the bleeding in the gum, and then the gum is still at the level, but now the gum now is receding. A lot of gum now recede, and some of the tooth probably have to be removed because of this problem. So this is how it appear or it looks like in the mouth, the periodontal disease. So to understand periodontal disease, we need to understand the inflammation. Right? This is the academic part that I'm talking about. The inflammation, this is very interesting. We need to know about inflammation. Most of us probably study biology before, and we know this. The inflammation system is our body system that is very powerful, that protecting us from any attack from outside. Right? If you look at this example, the attack is from the splinter that penetrate the skin, and then this splinter carry along the bacteria, right? Carry along the bacteria. So our body, the immune system, is so functional. We immediately try to kill the bacteria and then try to heal the condition. If immune cell that available at this site cannot do the job, immediately the cell will travel along our blood vessel, will be escaping from the cell, from the blood vessel, and come to help our armies of the cell to fight with the infection that coming in. Very interesting, right? And then after all the bacteria have been removed, the cell now we act like I mean, they try to build up again our tissue. And then this is what we call healing that we know in our medical or dentistry study. So basically, our body system is very powerful, try to defend this from the infection. In some case, when the condition where the infection cannot be removed, so the inflammation keep continuing, right? Keep continuing. And then if it taken too long a time, it become a chronic inflammation. So there is a difference between chronic and acute inflammation that we need to know. This is a very easy, important info, in fact, that we should know. Even if you are not in medical or in dentistry, we should understand this process. And if we understand this, we understand our body very, very well, because this is a very powerful tools that our body have to protect us from the medical problem. You see, this is what is probably relate to you. I told you just now that this is a chronic inflammation, like a cancer, like a diabetic, cardiovascular disease, inflammatory bowel disease. They are all chronic inflammation, right? And then if you look at here, do you see periodontal disease in here? Don't, right? We don't see that. And then we ask ourselves why. And then we get to know the answer later on. It will probably relate to your program today as well. When you look at this chronic inflammation as well, when you look neurological disorder and chronic inflammatory disorder, the same thing, the diabetes. Diabetes is actually part of the chronic inflammation as well. Now we don't see periodontal disease as well here. You know why? Because and then when we look at this modern paper, nature immunology, and we found this one here. Then we found this periodontal disease in the teen because one of the one of the author for this paper is someone from the dental field, right? It means that when medical write a paper, they start not including the dentistry part in their whole understanding of the disease. Right, it should be included because the dental part also is part of the whole body. So this is the things that I raised at the beginning of my sharing just now, that it's good that at your level you already start to communicate and start to make an arrangement to get a link between medical and dental team, so that you know at this point that this should be a holistic approach then, and it should be approached in a holistic manner, right? And then we ask again, is periodontitis a chronic inflammatory disease? Can you already know the answer, and then you just want to give more in the form of graphic presentation. So this is periodontitis. This is rheumatoid arthritis, the inflammation inside the joint or around the joint. And then this is inflammatory bowel disease. All these are the reaction of the inflammation, a chronically involved inflammation in our body. And they are actually similar, and then not much different in the reaction of the tissue. Okay, when we look at the rheumatoid arthritis as for, because rheumatoid is the closest resemblance to the case of periodontal disease, it involves the inflammation of the tissue, right? Inflammation of the tissue. At the same time, it involves inflammation of the what they call the bone layer of the lever, right? The cartilage things and everything, right? If inflammation is too bad, it causes resorption of cartilage and probably some of the bone. Same thing with the periodontal disease, the inflammation of the tissue and the bone that's surrounding the tissue. Okay, so this is just previously I just mentioned about how it appear, how it's different. And probably you want to ask what caused periodontal disease, right? What made periodontal disease to happen? Basically, this is for me personally, I think this is the most simple disease that we can understand. This is only about the hygiene type of disease, right? If you cannot perform your oral hygiene, if you are not the kind of hygienic people, then you become having a periodontal disease, because it's occur because of the formation of, they call it dental plaque, right? Dental plaque on the surface of the tooth. If you read more, dental plaque is also called biofilm, dental biofilm, which is formed on the tooth surface. And then when we leave it too long, it becomes hardened because of the formation of the calcification. Well, our saliva contains calcium and something like that, all the minerals. And then if we leave it, the calcification occurs. When calcification occurs, it becomes more inflamed to occur. At this level, how hard you brush, you cannot clean your mouth anymore, because the formation of the calculus that happen here is actually hardened and stick to the tooth surface. At this level, it's impossible for a patient to clean themselves to, for example, try to get their periodontal condition restored to the normal, because it's impossible. At this stage, the patient needs the help of periodontist or dentist or any other dental practitioner. Sometimes in some country they call it hygienist. They need to clean all the factors that cause the plaque to form on the tooth surface. So if you can remove this part, then we can solve the periodontal problem. So what we need to understand a little bit about the oral bacteria in our mouth. We need to understand that in our GIT system, right? GIT system, we have from the oral as the initial start, and then it's end toward the end that you know where. So throughout the GIT system, the bacteria is always there, right? In the platonic form. It means that they are floating around in high numbers of species. But actually in the mouth is among the highest place where the bacteria accumulate, right? So they are very high number. But are they problematic? Are they causing problem? The answer is yes and no. In the normal condition, some people found that the bacteria in the mouth is actually can be beneficial to us, right? Can be beneficial to us. But until they become a biofilm, then only it become problematic, right? I explain to you why. See, this is a platonic form of the bacteria inside the mouth, right? They're floating around in a million in numbers. But the moment they stick to our mucosa, like on the cheek, on the tongue, our cheek and our tongue are shedding everywhere, right? Most of us know that our cells are shedding everywhere. So the bacteria cannot have a time to accumulate and become a biofilm on the soft tissue, because soft tissue shed away. So we have no problem with that. The problem occurs when the bacteria now sticking on the tooth surface. The teeth or the tooth surface are actually a hard surface, right? Which is not shedding away. So the bacteria have time to start and accumulate and grow and become mature. When the bacterial community is composed of so many types of bacteria in the form of biofilm that stick on the tooth surface, then this is a time they become problematic, right? This is a time they become parasitism. They start causing problem to our tissue on the side. This is another graphic that I want to show you to make you better understand. So this is naturally in the mouth, we have million of floating bacteria. Some of them have the opportunity or skill to attach on the tooth surface, right? The tooth surface. Immediately after we clean our mouth, they will attach on the tooth surface. But this initial kind of biofilm are not dangerous because there are immature type. They're not giving any problem. But somehow when they are sticking and then they start, the community now become very big community. And this is happen when we change habit, or we start smoking, or environments start to change. And then the biofilm now become virulence. All right. And now if you see now here, you can see the formation of biofilm, right? And then they start giving inflammation to the tissues around, right? Then when we leave this for a long time, eventually it become like this. The inflammation become larger and become larger. So if we want to understand the periodontal disease, actually we need to understand about this one. If we can get rid from this one, from formatting on the tooth surface, we can prevent periodontal disease. But unfortunately, we cannot do that because we try to do that, but awareness of our community are not there, so they are not really into it. And one more time, how good you are in cleaning your tooth surface, there are places that you miss during your cleaning. For example, at this area and this area. And then this part is actually that becoming the place that for inflammation to occur. They start to inflame at this side or at this side. So this is why we recommend a patient to go visit dentist every 6 months or every 1 year. The most that the less that they want to go every 1 year, so that the area that is not cleaned by patient at home can be removed by dentist at the clinic, right? Can be removed by dentist at the clinic. So this is the important of why we ask the patient to come and visit dentist every 6 months or paling teruk pun 1 year, every 1 year, right? To avoid this progression. So this is another way of explaining. I try to give more graphic and more interesting way of doing that. So this is the biofilm, right? They start accumulate on the tooth surface and then it become long. This is, you don't need science to understand this. If you have bacteria, a lot of bacteria, and then on the side of your gum, you don't need a good science to explain this. This gum will surely become inflamed and become radang, right? Radang is inflammation. It become inflamed. Okay. We need to know that even now, while we are talking or while you are listening, now our cell in our body is actually working to protect our healthy tissue, right? They are working together now, communicating, interacting to each other to make sure our tissue is healthy, even without infection, even without inflammation, because when we eat, some part of our tissue may get injured, right? May get injured. Probably the bone hit on this area. When the bone hit on the soft tissue, some of the tissue get injured. So the tissue actually come to the area and try to remove all the injured tissue and then build up again a new tissue to make the healing and then maintain the area as good as continuously good, right? In the event of the inflammation, when there is plaque happen here, so this activity of the cell inside the tissue become continuously increase. They become more increased because now we have a threat. Previously, we don't have a threat. We just want to modify our tissue, make sure the tissue is elastic. Make sure the tissue is new all the time. That is the natural work of our inflammation. But today, with the infection of plaque, they have to work harder because there are lots of bacteria coming in, and then they have a lot of things to fight. The bacteria have to be killed. So if I want to explain to you in a graphic way, I describe this plaque as the alien ship, right? Or you call it a mothership of alien ship, right? So you see, the alien ship is here, and then they start to, the troopers now is going down, right? The troopers, all the invasion armies of the alien attacking our bodies now, the tissue. right? This is the just for the graphic. I mean, then our body is not without defense. We have a starship troopers that fighting the bacteria or the aliens that come into our body, right? And then this fight, if you notice, this fight occurring very long time ago without destruction of the bone. It can happen for 2, 3, 5 years, 10 years without the destruction of the bone. It means our body system is very good in fighting the infection, or what do you call that, attack from the alien, something like that. But because our army or our troop cannot reach the mothership, so this fight we cannot win, right? We cannot win because nobody can disturb this mothership. But if we get help from doctors, dentists that can remove this mothership, everything can heal again, right? But if this fight continually happen, and then without removing the mothership, then somehow the bacteria or aliens started to win the game, and then they have to withdraw, right? Our army have to withdraw now. This is what happened in our body system, where osteoclast started to eat the bone, right? You remember osteoclast started to eat the bone, and then the bone start to resorb, and then the tissue start to resorb away and away and away, and then eventually the tooth have to be, removed because of the resorption too fast. And interestingly, the moment we remove the tooth in any other condition, this one is just for the figure, the tissue will immediately go back to normal. So it tells us the importance or the terrible role played by the biofilm on the tooth surface, right? The mothership has to be removed. So dentist is usually a hero dalam this movie lah. They remove the mothership. Okay. So this is a graphic explanation. I tak nak ambil too much of your time. We try to be on time, okay? So the clinical sign of periodontal disease, actually the first part that you need to know is the initial part is the inflammation sign. Inflammation sign, if you look in the mirror, if you are a medical or dental, you can actually identify that. But if you're not trained to it, you cannot see the difference between healthy and inflammation side of the gum tissue. But one thing that you can or we can actually know if the condition is inflamed is when we do the brushing, everyday brushing. The moment we see blood during our brushing time, it shows that our gum is actually inflamed, because the inflamed gum is actually easily bleed. The inflamed gum is actually easily bleed. So the moment the brush reach this area, and then it can produce blood immediately. So when we brush our teeth in the morning, and then we see blood, the color of our brushing, apa tu? Dia panggil toothpaste started to get red. It shows that our teeth is inflamed, and then if it's still continuing for a few 1 or 2 days, you better go to check with your dentist and then see if there's something that causing to that problem. Because when that's happened, this actually shows that the inflammation already occurred. But we need to know why, and we need to know how. And then if we know how, probably in this case, due to formation of the calculus, then we can remove the calculus and then allow our tissue to heal again. Okay, now what is the important or the implication of this disease to our community? Kan? What's the important? The first part that is very obvious is that when periodontal disease occur, it causes the teeth to be removed, and the teeth start to mobile and have to be removed. Because of that, it will disturb the function of the teeth. Now we don't have enough teeth to support the function of mastication. So those old people that don't have enough teeth, they have problem in chewing and enjoying food that they love. they probably can relate to the problem with the eating problem that they have in the old age or early age. This is the social problem. It's social problem related to the periodontal disease, which is usually related to the bad smell when you have periodontal disease. Then probably this is small thing. It looks simple, but it's actually affect our community, kan? It probably cause a splitting of boyfriend and girlfriend because of the smelly mouth, right? And then probably uncomfortable living between spouse or husband and wife. And then probably at the workplace, I mean, when you have problem, your mouth smell too much, and then people start avoiding you. So this is a social problem that probably very small thing. It can affect people tremendously as well. And then when you have the all many teeth removed and the condition of the gum is not right, now it goes to the aesthetic part of us, kan? The aesthetica issue. People look at those who don't have teeth or the crooked look kind of teeth. Then people relate to the problem with the hygienic status of that person, kan? If you are already an established people like Jack Ma or people who are already rich, they don't care about the condition of your teeth. But if you are just who apa BBNU, people say that now, baru nak up and something like that. I mean, when you start to promote yourself, and then people look at your appearance, and then this can be part of the factors that contribute to the problem, right? When you look at you, the condition of the teeth, the mobility of missing teeth, then people start judging. And if you are at the beginning of your career, it probably can affect you, right? And then the last one, but not least, is actually one of the biggest problem is that it involves cost. If you don't take care of oral health at the beginning of the life, probably at this time you're not worried much. But when you get older, you want to restore back all the missing teeth and everything. It will cost lots of money, especially if dealing with a new kind of dental treatment, for example, implant, right? It costs a lot of money. So this is among the implication of the disease, periodontal disease, to our society. Not to mention about the role of periodontal disease with the other part of the other part of the body, right? If you look at the understanding of rheumatoid arthritis, it is known fact that inflammation in the arthritis can spread throughout our systemic system, and then causing the arteriogenesis, right? Formation of myocardial infarction, stroke in the other part of the body. And then it's also cause insulin resistance and other form of density problem in our tissue. This is a known fact. When you have inflammation of one side, this inflammation can actually travel through our body system and cause problem to the other part of our tissue. See, if you look at the other evidence also, this is from the other papers, psoriasis, inflammatory bowel disease, SLE, rheumatoid arthritis, all these are inflammatory disease which are known, at this level, with some evidence showing that this inflammation from this inflammatory disease can spread throughout our body system and then cause problem to our endothelial tissue, right? Endothelial tissue mean a tissue that involved in smooth muscle cells, something. So back to perio. How perio can be such a problematic? I'll describe to you. When you look at the disease in the mouth, right? This is a disease in the mouth, and then usually this is a probe that we use to measure the status of periodontal disease. We measure how deep the pocket form. Usually it goes up to 5 millimeters, 6 millimeters. And then if we calculate the amount of surface which are involved, right? And then involved in inflammation, and then we add up all together, essentially the size of inflammation inside the mouth, it can goes up to the size of the palm, of adult palm, right? Size for adult palm of inflammation. Can you imagine if you have inflammation of this size, sticking on your face, right? You cannot sleep. You will be immediately go to the doctors or if you are in the kampong, at least you go to the bomo or something, and try to get rid of this aside or palm on the face, right? But when it happened inside the mouth, you just close the mouth and then forget about it. Interesting fact about the periodontal disease is it's not giving a patient a very painful condition, right? It's not giving a very painful condition. It's just give some sort of comfortable, but it's not giving a very painful condition. 3:30. All right. Okay. All right. So same thing with periodontal disease as well. The periodontal disease also, the inflammation can travel in the blood system and then causing problem to the gut system or the heart problem that you mentioned in the rheumatoid arthritis. And also some evidence shows that it also can contribute to the preterm low birth weight. Although this one is very not a very high evidence, but people start to study and look at this area. Okay, what else? Okay, we go to the treatment. Okay, we are almost at the end, so be patient, just a little bit more. So the treatment of periodontal disease is a very simple actually. It's about the scaling and root planning is about removing the dental plaque, and then we try to educate a patient, and then if the thing is so bad, the inflammation is so bad, we try to use antibiotic, and then some have to go the surgery as well. So basically, it started with the education. We try to give awareness to the patient, and in many times we try to educate patient how to brush the teeth properly, because most of our patients claim that they brush the teeth sometimes 5 times a day, right? Every prayer I brush my teeth, but evidently when they come to the clinic, there are a lot of inflammation in the mouth. It shows that the brushing technique is not good enough. And I saw a question in the initial when you register, some of you asked about the type of the brush that you should be used. Actually, the mistake most community is that they try to get the hardest brush possible for their toothbrush, because they think they feel good when they brush their teeth using the hardest bristle brush. Actually, the bristle is not important. Our biofilm, our dental plaque is very soft. It can be removed with just the smoothest bristle of our toothbrush. We don't need the hardest one, because the brush is the biofilm is actually very, very soft. It can be removed easily if we do a correct technique. We don't need a hard one, because hard one will cause injury to our gum and sometimes cause the gum to recede away. Recession, you see the tooth become longer. So usually when you go to the dentist or periodontist, the only job is try to remove this part and try to clean the part of the gum that is infected, and then hopefully it can heal again away. But in the case of the severe case, we have to do the surgery. There's a lot of case involve surgery also, corrective surgery, and then I'm not going to discuss the surgery part here because it's not I think beneficial for our discussion today. So I think that's all for my sharing today. It's just that this is part of the surgery where we put the dressing. So for the conclusion that we know that oral health is very important. It's some part of the body system, right? It's part of the body system. So what happened in the oral is actually connected to the other part of the body. And then what happened in the oral is actually contribute to the general health of our patient as well. Actually, now people are looking into the role of the oral bacteria in the general health of our body, right? Okay, I think that's all for my sharing. I hope it's enough for our purpose today. And then, well, if I have any question that I can answer, right? Thank you. I hope it's enough. I don't want to go too deep because it's going to be boring on the afternoon of Saturday. I don't want to, I mean, rosakkan your hari Minggu. Okay, thank you very much. Victor, can you take over?
Yes, certainly, Doctor. Thank you very much, Doctor, for the amazing and informative session. Now, I'm sure we have a better understanding on periodontitis now. And like what has Doctor mentioned just now, oral hygiene is very important because it is an indication of our general health. So we should follow the correct way to do it in order to keep our oral health at the best state. I believe we have all gained greater insight and valuable knowledge on periodontal disease. We shall now proceed with the Q&A session, and participants can now drop down the questions in the chat box if you have any. Doctor, I think you can stop sharing your screen.
Okay, great. Thank you. Okay, good. Maybe to proceed, I answer one of the questions from the form. Can good oral hygiene cure my periodontal disease? See, so the question asked is that, can good oral hygiene cure my periodontal disease? You know, when this is the most misconception occur among our community as well. When they already have periodontal disease, that's it. They need help from the dentist or periodontist, because when the inflammation start to occur, it means there's something that's stopping or causing the gum to inflame. Usually the calculus formation, or sometimes the restoration of the teeth that look not being done by other dentists. So those are the things should be clear first before patient go to take care of good oral hygiene again. What I'm trying to say here is that the moment you have periodontal disease, we have to go to the dental and find out what, and then we need to settle that problem first, then start back a good oral hygiene for the to maintain a good oral health. Itu satu. Okay. Anything else?
Thank you very much, Doctor, for the explanation. Now, can we move to the next question? The next question is tooth loss a natural part of aging? What causes tooth loss? Would I lose my teeth due to gum disease?
Okay, the aging is actually, we need to understand aging part is something that we need. It's a different story, a different knowledge. When we age, our immune system start to function in a little bit, lower capacity, right, compared to our young age. So when we become aging, our system started to become low. So when we age and then we didn't take care of our oral hygiene, and then this is a time our body system cannot fight the incoming problem or incoming infection. So that is why usually oral disease occur at the older age, because at that time our body system are quite low at fighting the disease. Yes, if we have severe periodontal disease, we can it can cause further tooth loss, right? So yeah. Next question.
Okay, thank you very much, doctor. The next question is poor oral hygiene the only cause of gum disease?
Yeah, as we understood the what do you call that, the etiology of gum disease, right? It's mainly related to the plaque formation. Although we don't know how the plaque causing periodontal disease as yet, but it's very sure now we can say that when there's plaque there, almost always periodontal disease occurs. So basically what we can say, yes, it's oral hygiene. It's almost always number one cause of periodontal disease. Right? I can say almost always because there possibly there are other things that cause, but probably it may be related to the biofilm as well. But for the benefits of audience and community, we can say that oral hygiene is a straightforward cause of periodontal disease. But if you want to go to the academic discussion, we can look for the possible other part that is causing the periodontal disease. But it still relate to the oral hygiene as well. Yeah. Okay, we can go next.
Thank you very much, doctor. Now there's one more question. How does diabetes relate to periodontal disease?
Okay, good. This is a good question. The diabetes, we know about the diabetes, right? Diabetes is when patient has diabetes, all the small vessels start to become stiffened, right? All vessel or small vessel artery, they become stiff. When they become stiff, they become brittle, and then when they become brittle, they are not functioning well. That is why when at the area of diabetes, when you look at the extremities like fingertips or extremities, right? There are the places where go for the gangrene first. Same thing with the in the periodontal tissues, it consider the extremities as well because those are the arterioles at the area of the gum. They are already brittle and not functioning well as capillaries. So when this occurs, it causes problem in the healing process and also any activities of immune reaction that's supposed to be protective, right? When they are not functioning and then they're becoming very well in the protecting our tissue. So that is why diabetes is in any part of the healing process, it will become problem. So that is why the periodontal disease and diabetes are really very have a very close association between the two. Okay, ada lagi ke?
Thank you, doctor. Yes, there's one more question. Is it true that horizontal brushing will cause recession of gums?
All right. Okay. For me personally, I believe in the technique itself. I mean the type of brush that you use. If you use the hard brush that you use any technique also, it cannot be achieved and then it can be problematic to your gum. As for the technique, if you can master any technique, for me it doesn't matter. As long as you can clean your mouth properly, any technique that you can master, it's okay. Except if you are a periodontal disease patient, then only we need to cater you with a special type of brushing technique. Because some in the periodontal disease now you don't have a very standard set of teeth now. You have a teeth which has different condition. Because it become longer now and become hole in between the teeth. It has hole in between the teeth. Now it's special set of condition. At that time, probably we need to teach you a special type of brushing technique so they can accommodate to the condition of the disease. But in general, for the general patient or general community, any type method that you can master as long as you practice, it should be okay. But the things that I want to stress more is that the type of the brush, to try to choose the soft brush. because we must remember our dental plaque is not a very hard one. It's a very soft dental plaque. It can be removed easily. Those which are hard to remove is called the calculus, which cannot be removed in any type of brushing method or brushing material. You have to go or clean at the dental clinic. And habislah kita for today. Anything else, Victor?
Yes, doctor. There's one last question. One last question,
Ada
doctor.
lagi. Okay, good.
And good oral hygiene cure my periodontal disease?
Sorry? Macam mana? What's the question?
And good oral hygiene cure my periodontal disease?
Oh, I already answered the first one. I already answered at the beginning. That's the first question I answered at the beginning. Anything else?
Okay, so I think that is all. I think that is all for the Q&A session.
Great. Very good session with you all, and then good effort by you all, and then congratulations semua. All the participants also congratulations for supporting your team. Okay.
Thank you, Dr. Raja, for sharing with us about periodontal disease today. Before we end this webinar this afternoon, we would like to have a photography session together to commemorate this webinar. All participants are encouraged to turn on your camera. Don't be shy, everyone. Turn on your camera. We're going to take a picture of today's event and remember it. Show your handsome and beautiful faces, everyone. Don't be shy. I'll give another 1 more minute for everyone to turn on your camera. Okay, now I'll take the picture, everyone. 1, 2, 3, smile. Okay, I'll take another one. 1, 2, 3, smile. Okay, thank you everyone for cooperating with us. You may now turn off your camera. Once again, we, AMSA USM and UPM, would like to express our greatest gratitude to Dr. Raja for spending time to enlighten us with your valuable knowledge on this topic this afternoon, and also to all the participants for lending us your ears and staying with us until now. We hope that everyone enjoyed and benefited from our periodontal disease webinar today, and we hope to meet you all again in future AMSA events. With that, our webinar this afternoon has finally come to an end.